Welcome, everyone, and thank you for those joining us live and to those listening in afterwards. We're pleased to be delivering this event, the fourth one in a series of events forming FIP's COVID-19 online program, Responding to the Pandemic Together. We're also really proud to be collaborating with Pharmapod to be delivering this virtual panel to you. My name is Lina Badr, and I work at the International Pharmaceutical Federation, FIP, as its lead for workforce transformation and development. I'm very pleased to be moderating today alongside my colleague from Pharmapod, Ashleen Freeman. Ashleen is the Solutions Manager in Pharmapod, where she has been working for 6 months. Prior to this, she has worked as a business consultant in the health sector for two of the big four professional services organizations. Previously, Ashleen was an academic, having undertook a doctorate in psychology in the University of Leipzig, Germany. She also spent some time working in the World Health Organization in Geneva in the Department of Mental Health and Substance Abuse. She sits on the board of directors for one of the hospital groups in Ireland and has recently completed an MBA from Trinity College Dublin. Welcome, Ashleen. I'll just very quickly run through a couple of slides before we kickstart today, just to tell you a little bit more about this online program, give you a chance to know a little bit more about its aims and purposes and how you can contribute to some of the ideas. We've established this program in response, of course, to the pandemic, and these events forming part of this Responding to the Pandemic Together program aim to allow us to provide some relevant information and present our interim guidelines for pharmacy around the world. We want to use this as a platform to share and discuss strategies adopted by pharmacy and pharmacy leaders, including, of course, our member organizations at FIP and how they've responded in their respective contexts. We want to also use this to delve into some specific areas or sectors, such as today, we're looking at patient safety in particular. We want to also engage frontline workers, so you'll be seeing some of our upcoming events focused on having conversations with real pharmacists and frontline workers from around the world to share their experiences. We want to use this to also discuss the implications of the pandemic, consider its impact on everything related to pharmacy, and also use this as an opportunity to assess and discuss the evidence behind treatments, vaccinations, etc., etc. So I would just use this opportunity to share. If you'd like to share ideas on webinar topics we should feature, or if you'd like to share your own story with dealing with the pandemic and you'll be willing to be featured on one of our upcoming episodes, please do email me at lena@fip.org. Thank you in advance for that. Also, some important links and resources to share. We've established the FIP COVID-19 Information Hub webpage. This is a comprehensive webpage that contains all of our resources and outputs related to the pandemic, including the recordings of previous webinars we've delivered this month. So please do visit this website and explore all the resources available on there. This is a chance for you to also share resources from your organization or resources you're aware of that you think we should feature, and there are instructions on there on how you can share them. We've also established a new Facebook group, COVID-19 and Pharmacy. You can search for that on your Facebook browser, and this is a really great platform to engage with colleagues all around the world. We have tens of thousands of members joining that group within a couple of weeks. Some house rules. This webinar is being recorded and will be freely available. And I'm already receiving the first question from the audience, so thank you for showing the initiative. And we will be able to share some slides if you do want to request them from us, but the recording will be freely available on the Information Hub webpage. I will also want to direct you towards the questions box, so that's how you can enter your questions. Please use that tool to send us your questions. Send them as soon as you think of them, and we'll pick them up later during the Q&A towards the end of the webinar. And your feedback about our webinars is always welcome. If you have any feedback about the way we're conducting webinars, how we improve them, please email webinars@fip.org. Finally, today we'll be releasing some polls throughout. Some of our panelists will be asking you some questions. So when prompted, a poll question will show up on your screen. Please do take that when it does come up. So thank you in advance for participating, and it will just help us get some insight into what you are experiencing. Learning objectives of today, I'm not going to read the slides, but do tell you that we'll discuss the importance of patient safety in pharmacy for FIP, and especially during these times. We will also delve deeper into the role of pharmacy regulators, which is the main focus of today, and how they can support the profession to not only uphold safety, patient safety, but also how to align and respond to the WHO patient safety challenge. And we'll be talking to you about that later on. We will also feature an example from the Ontario College of Pharmacists and what they've done with their patient safety program. And finally, we will also describe the role of our partner, Pharmapod, as a patient safety solution providers and outcomes of its global partnerships with both FIP and OCP, as well as other partners around the world. I will now hand over to my esteemed co-moderator, Aisling. Aisling, thank you so much.
Thanks very much, Lena, and thank you for the kind introduction. So Pharmapod are delighted to co-host this webinar with FIP, who we've been proud partners of for the last year, to jointly address the WHO's Patient Safety Challenge. So without further ado, I have the absolute pleasure of introducing Dr. Catherine Duggan, who is the Chief Executive Officer of FIP. So Catherine Duggan is responsible for visionary leadership, support, development and advocacy across the 151 member organisations and the 4 million members FIP represents. She's responsible for developing and delivering the strategy, planning and working across global organisations such as the WHO and UN and other international professional groups. Dr. Duggan has published widely and presented at national and international meetings. She is a recognised leader across the profession, working with many networks within and across the profession and more widely, health and business. Catherine has worked in community, primary care, hospital and academia. So I'll pass over to you now, Catherine. Thank you.
Thank you so much, Aisling. That's a really lovely introduction, and thank you to both you and Lena. I think we have a really good example of how together we are stronger, and we'll build on that as we go through the presentation today. So a great pleasure to be part of this webinar today. And also the issue is very, very close to all of our hearts, heightened in the COVID agenda, but still relevant to pharmacy, no matter what we do. So FIP was founded in 1912, the International Pharmaceutical Federation, and we're based in the Netherlands. It's the global federation of more than 150 national associations representing millions of pharmacists, pharmaceutical scientists, and pharmacy educators around the world. We actually have academic institutions as members, and we have science organisations as members as well. We are a non-governmental organisation, and we've been in official relations with the World Health Organization since 1948, since its inception. The vision of FIP was relaunched a couple of years ago now, when I started. If you read this vision, never more has it been important that the world where everyone benefits from access to safe and effective medicines and pharmaceutical care is one we strive to deliver. And today, of course, safety is paramount in the world we live in. And you can see that the longer term impact of COVID-19 will affect access to medicines and the effectiveness of medicines and how we deliver care. Today, we will focus on safety. The FIP mission is to improve global health by supporting the advancement of pharmaceutical practice, pharmaceutical science, and pharmacy education. And part of today is really looking at the interface across all three. How can we learn as we go? How can we influence science, use the influence of science to influence and impact our practice? And how can we ensure we are safe in the practice we're undertaking? Our 6 strategic outcomes launched last year. 3 are very, very external facing, and I think never more relevant than today. We seek to strive that everyone has access to the medicines they need. Everyone has access to the health and medicines related information they need. Never truer in the era of fake news. Everyone benefits from new medicines, services and health technology. Never more true in the repurposing of existing medicines for new therapeutic advancements in COVID-19. The next 3 strategic outcomes really focus on the way in which FIP can support pharmacists to ensure responsible and quality use of medicines, to work with healthcare professionals and patients so that we ensure comprehensive healthcare for all. And then the final one is about how we ensure FIP is vibrant and growing and meets all the needs and functions of you, our members. Last year, around this time, we were working on the first memorandum of understanding between FIP and WHO, which sought to strengthen the partnership we had for 70 years beforehand. And the work streams that we're really focused on are around the workforce, patient safety, delivering primary health care, and achieving universal health coverage, as well as other specific areas. Today, of course, our focus is patient safety. We also have another mini announcement. It's 1 year minus 1 day to the day of our partnership endeavours with our colleagues at Pharmapod. So today is a mini celebration of the fact that once you take the leap into working in partnership together, you can achieve great things. And I'm really glad that we are launching this podcast, this event today. So with patient and medication safety, there's a few things here that are specific to pharmacists. We really can enhance our role in minimising preventable harm to patients. We know that medicines are the most common healthcare intervention to cure and prevent diseases and mitigate symptoms. But we also know the flip side of that is that 1 in 4 patients are harmed by care they receive. We know that adverse events are responsible for a large proportion of emergency department visits and hospitalizations. And we also know that the estimated global cost of medication errors is around $42 billion per year. We know, as we said before, when you work together and you create collaborative systems, we can foster safety culture and ensure patient safety. And you actually have to work on the culture and make sure that you do not have a culture of blame within your system. Prioritization of patient safety on the global health agenda helps us to achieve and enhance our contribution to patient safety. If you think about the minimising preventable harm to patients, FIP has been working on this for many years. We published a report in 2019, Patient and Medication Safety, which provides information about what pharmacists can do, from the individual to the team. We collect evidence of positive impact, and we acknowledge the need to change the healthcare systems across our countries. In summary, pharmacists can improve patient safety through a safety culture, through patient engagement, through interprofessional collaboration. And once you have all of those pieces of the jigsaw in place, we can reduce avoidable harm caused by medication errors. We have to play our part. The key areas for pharmacists to act upon, therefore, include polypharmacy, where patients have comorbidities and may have to take more than one medicine for one condition. The levels of risk for interaction between those medicines is huge. And if we can think about what medicines a patient doesn't need, that can often impact care in a positive way. High-risk situations, such as when patients are already suffering from comorbidities and then are more at risk of infections, as we're seeing in COVID-19, and transitions of care. When a patient has an acute admission to a hospital, that's a particularly risky time for their medicine's safety. And also when patients move from hospital to home or to a care home, that's also an acknowledged area for risk and safety issues. It's exactly where pharmacy can make a difference. Advocacy for the pharmacy profession takes place in many ways, and FIP contributed to the development of the WHO tools, the 5 moments for medication safety, WHO patient empowerment material, and also reviewed the WHO patient safety research guide. We're involved in finalising a reference document with evidence and examples of activity around the world, and actually adopt and adapt this for the way in which we engage with you, our members. There are other ways in which we, as FIP, can advocate for the pharmacy profession, and our attendance at global ministerial summits on patient safety is an attestment to that. One in London in 2016, Patient Safety Global Action Summit. One in Bonn in 2017, Medication Without Harm. The Tokyo Summit in 2018, which resulted in the Tokyo Declaration on Patient Safety, and then in Jeddah in 2019. In Jeddah in 2019, we actually endorsed we highlighted the pharmacist's key role in ensuring patient safety, and we presented best practices from around the world. And here you will see two colleagues from my team, Susanna and Lena herself, at the Global Summit. At that summit, FIP endorsed the Jeddah Declaration on Patient Safety, and the declaration specifically refers to the promotion of medication safety in community pharmacies and strengthens the efforts of patient empowerment and community engagement. You'll see here on the screen that the 8th item, promote medication in community pharmacies, really puts the community pharmacy on the platform. It's really important for us to understand the importance of promoting our profession in these arenas. Governments need to know about pharmacy, they need to have evidence about pharmacy, and they need to hear about the impact we can play. We also advocate for the pharmacy profession on World Patient Safety Day. It was established in 2019 to be observed annually thereafter, fully supported by FIP. We celebrated the very first World Patient Safety Day last September under the main theme, Patient Safety, a Global Health Priority. The World Patient Safety Day theme for 2020 will focus on a need for a safe environment and the safety of health workers and patients, never more important than it is at the moment in the COVID crisis that we're all facing. So, patient safety, never more important than now, I would argue. If we think about where we are in our different countries, in our different localities, as we face this global pandemic, patient safety risks become more heightened than ever. We see this through medication errors linked to additional workforce pressures. We see this through the interactions that patients may be suffering with their existing therapies. We see this in the potential for drug reactions and adversity to remedies and treatments, including the inappropriate advice or the inappropriate prescribing of different therapies or fake news. We see this in the big issues and pressures on trying to find new vaccines and to repurpose existing medicines for new treatments. We see this also in the emerging need for new tests and diagnostics, but also the ways in which we have to ensure safety around these areas. The repurposing of existing medicines doesn't come without its own challenges. Not only can those medicines really fast track into patient use because they have already been proven to be safe in certain populations, but we also have to ensure that they aren't more risky or less safe than when they are being used for their existing indications. Where there were problems before in the supply chain and medicine shortages, we've seen those exacerbated through this crisis. But what we have also seen, and we will see today, are emerging and responsive changes to pharmacy regulation, which are enabling patients and the public to receive greater access from the essential workforce our pharmacy profession provides. I wanted to mention, before we go to my poll, the FIP Forum of Pharmacy Professional Regulators. We established a forum of regulators in 2018 to bring together professional organisations with regulatory oversight of the profession, both those that sit within FIP membership and those that can't, so that they can consider issues of standard setting, of safety and public protection. There's a real big need for us to recognise that international collaboration and potential coordination in regulation is essential for us to learn. This is why this webinar today is really important for us at FIP. So we learn from each other, we build on successes, and we also build on strengths. Advancing the pharmacy workforce capacity and sustained performance and the scope of practice of pharmacists to ensure patients are safe and that the pharmacy profession practices in a safe way but can adapt to increasing patient need is really important. We all need to contribute to protect the public and achieve optimal health outcomes through this competent and regulated pharmacy profession of ours. We also know that as a highly regulated profession, we then provide safe systems for other health workers who work under our umbrellas. So I'm now going to host the first poll of the session. We would like to know a brief summary of all of the issues that I mentioned to you earlier on that we see exacerbated in our practice under COVID. Which combination of these affect you in your practice today? And now I'm going to hand over to Lena.
Thank you very much, Catherine. We're getting a lot of answers and we'll share the results in a moment. And I do have a couple of questions. Maybe I'll ask you one while waiting for the poll, is about what steps are FIP taking to support pharmacy regulation roles in countries around the world? And this is actually a question from Pakistan. How can we actually provide support for our member organizations with regulation issues? And we'll save that question for later. So poll results, we can share. We'll close the poll and share the results. The majority of the answers are actually about supply chain medicines and shortages. 58% say that this is really affecting them following emerging and responsive changes to pharmacy regulation, as well as medication errors linked to additional workforce loads. So these seem to be the top 3 issues affecting pharmacists around the world. Thank you everyone for this really great insight, and we'll really use these results for forming some of our questions surveys for the future. I'll hand over to Ashleen to introduce our next panelist.
Yep, thanks for that, Lena. And thanks so much for that, Catherine. Under your direction, FIP is an amazing example of how leadership, innovation and vision can support FIP members and the pharmacy profession during these uncertain times to prioritise and deliver patient safety in practice. So thank you so much for that presentation. So now I'd just like to introduce Anastasia. Anastasia is a policy advisor at the Ontario College of Pharmacists, OCP. She led the development and implementation of the Assurance and Improvement in Medication Safety programme. Prior to working at OCP, she was the pharmacy manager at a multi-site hospital and a manager at a community pharmacy. Anastasia has worked in both leadership and direct patient care roles in various settings. She is taught at the Leslie Dan Faculty of Pharmacy at the University of Toronto and at the School of Pharmacy at the University of Waterloo. Anastasia holds a Doctor of Pharmacy and a Masters of Health Administration degree. She currently sits on a board of directors for a local community organisation. Thank you, Anastasia, over to you.
Thank you so much for that introduction. I'm happy to be here to speak to everyone today from the Ontario College of Pharmacists. We are the regulatory body for pharmacy professionals and pharmacies in the province of Ontario, Canada, with a mandate to serve and protect the public while also supporting pharmacy professionals to provide safe, quality, and ethical care. Feeling connected via technology is perhaps more important now than it ever has been. So we do want to acknowledge the impact on COVID-19 and how it's impacting frontline pharmacy professionals around the globe, as we saw the interesting results in Catherine's poll. The situation has really highlighted the important role pharmacy professionals play within the healthcare system and in patient care. Around the world, we all have a shared goal to nurture patient safety while supporting each other. And we recognize that our pharmacy professionals need to be healthy and well to protect and treat our patients. Now, there's no single best approach in how to respond to the pandemic as a regulators. There are many dependent variables that are shaped by elements such as local context, legislation, stakeholders, which all contribute to the role and response of the regulator. We are collaborating regularly with many others, organizations and bodies, including other regulatory bodies and other professions, national and provincial associations, also Health Canada, and others to support the delivery of safe quality care amidst the pandemic. Learning from and with each other is paramount to patient safety, and this all hinges on the ability to gauge in open conversations with others. So as we pivot and speak a little bit about medication, I just have a question and a poll. Catherine talked about safety culture, and we're just interested to hear, do you feel comfortable and confident speaking about medication incidents or errors and near misses in your practice?
Thanks, Anastasia. We're already getting an overwhelming yes of about 75%, and the poll hasn't closed, so that should give us an understanding.
Thank you. It's good to hear. Great. So looks like many of you do feel comfortable But we recognize that there are still some challenges with the safety culture and speaking openly that we recognize and that we want to learn more about and determine how we can support that. I'm pleased to have the opportunity today to share with you a little bit about our AIMS program. As mentioned in the introduction, I've been involved in AIMS, the Assurance and Improvement and Medication Safety Program, for a couple of years. I really believe in its value and intent to protect patients and support us in our commitment to quality and safe care. This program is really about being able to use and understand data to help us know what's happening and why. But most importantly, what can we do to prevent that? When we talk about quality improvement and improvement care, it's important to have a common understanding of what we mean by quality care. We often think of the 6 domains of quality, which are depicted here. All of these elements are important to consider in thinking about quality improvement. The college, in partnership with stakeholders and in collaboration with others, including patients, developed a set of quality indicators for community pharmacy to better understand the impact of pharmacy on patients, which can be used to support quality improvement. So using quality and data resonates throughout the college, and we are wanting to really embed that culture in the profession. We all recognize, though, that medication incidents can and do happen, and as we saw with the poll, there may be some exacerbation by the pandemic situation. Melissa Sheldrick is depicted in the picture, and she knows firsthand the tragic effects incidents can have. Her son, Andrew Sheldrick, is also depicted in the picture. He tragically passed away in 2016 at 8 years old from a medication error. The medication baclofen was used instead of tryptophan to fill a prescription for oral tryptophan suspension. After taking a dose of the suspension, which contained more than the regular adult dose of baclofen, he tragically passed away. Tragic events are often the cornerstone of large-scale change. Melissa has helped to galvanize the medication safety movement with her messaging about the culture of safety in pharmacy as it relates to learning from incidents and making the system safer. This type of error could have happened in other areas. How can we then share those learnings to prevent it from happening further? And her message remains important, as important today as it was when she first became involved with the college, as she helped us to introduce the program. You may have noticed in the AIMS, or if not, after or when we have the AIMS logo again, you can take note that the A and the S are different colors. And that really is to pay tribute to the living legacy of Andrew. Also important to remember Melissa's poignant reminder that there's a patient behind every prescription. Before I go much further, I wanted to provide a brief review of the journey to where we are today with AIMS. After the tragic passing of Andrew, the Ministry of Health reached out to the college, and there was a shared commitment to putting in place a program to understand how often this type of incidents happen, why they happen, and how it could be prevented. The college promptly created a task force to look at this, which included professional members and a patient advocate, Andrew's mom, Melissa. Their recommendation was the creation of a continuous quality improvement program that included mandatory incident reporting as one of the several elements. It included standardizing the approach to quality improvement in community pharmacy with the #1 goal of reducing the risk of medication incidents. The recommendation was ultimately and unanimously approved by our council or board, and the college worked very hard over the course of a year to develop the program. It was implemented in a preliminary phase involving 100 volunteer ambassador pharmacies, which provided feedback that fed into the provincial program. The program was officially launched in Ontario in November 2018 during National Patient Safety Week, using a staggered rollout to all approximately 4,500 community pharmacies in the province. Rooted throughout the entire program is a notion of a safety culture. A safety culture is not new in healthcare, and certainly it's not new in other fields such as aviation. And a safety culture, which some organizations may call a just culture, the focus is not on assigning blame, as Catherine also mentioned, but it's on openly reviewing and discussing errors and incidents within the team. And it was nice to see that many of you have that ability, but as mentioned, there is still room to improve that. Consistency in this approach is so important as it helps organizations and the people who are ultimately the heart of our healthcare system monitor and make improvements so that they know they're having an impact on quality and safety. These are the principles of a safety culture, and the AIMS is founded on these principles. Underpinned by a safety culture are the 4 pillars of the components of our mandatory program. First, it's report. You first have to have the data to give you the information to know what happened, how it happened, etc. This is achieved through anonymous recording of information in the AIMS Pharmapod system. Then it's important to document what happened so that the entire team can benefit from this information, and hence the importance of being able to have these open and honest discussions. Third is analyzing the information. It'll help teams know why something happened, how it could be prevented, and what steps can be developed to prevent that. Finally, it's important to share learning so that it's not just your teams, but potentially your collaborative teams, partners, and even the entire system could potentially benefit from what was learned. Provincially, as a regulator, the anonymous de-identified information is further analyzed to look for trends, commonalities, and themes into the number, type, impact, and reason behind the incidents, including near misses, with recommendations that can be shared. Not just with pharmacies, we recognize that it's about the health system and our partners as well. In regards to that, there is certainly a shared accountability for patient safety. For pharmacy professionals, it means recording incidents, taking prompt measures to document and analyze them, and the foundation of a safety culture. For the college and our partners, it means supporting education, analyzing anonymous data, developing recommendations and guidance aimed at reducing risk, and sharing broadly within the system and publicly so that we can promote accountability and transparency. A safety culture is what we are encouraging, and we expect everyone, including ourselves, to do everything possible to nurture this in pharmacy. Ultimately, patient safety is really everyone's business. For this, it also means listening and supporting AIMS implementation. As you'll see here, the definitions under the program for a medication incident and near miss. To give an example of how we're actively listening to make continuous improvements even to our program, we were hearing often the challenge of when to determine how and when to record a near miss, as they can often happen as, say, part of regular checks and balances, how to determine which ones to record. Understanding this can vary in different jurisdictions. We are expecting that teams consider the nature of the near miss, its implications to patient safety, and the extent to which it is recurring when deciding to record. We know that pharmacy professionals are doing all they can to support patients amid the pandemic, and we are conscious of your valuable time. The information collected then needs to be interpreted and analyzed to derive the benefits. A suite of continuous quality improvement tools, along with graphs and charts, are available in the AIMS platform to assist pharmacy teams with implementing improvements. In addition, provincial data is analyzed by an independent team of experts called the response team, which I believe Dan will refer to later in the presentation. Supporting a safety culture is also very important to us. And of note, the college does not have any ability to view information for a specific pharmacy or pharmacy professional. The first provincial analysis, called the Response Team Bulletin, was shared on International Patient Safety Day in September 2019. One of the findings was that 1 in 10 medication incidents involved the wrong patient. Viewing larger data sets often helps with supporting patterns and trends that otherwise may appear as outliers in smaller data sets. It's also a reminder that you are not alone in seeing specific types of incidents. Through AIMS, we can determine how and when to mobilize systemic efforts to mitigate these risks. The college also released a data snapshot which summarizes the AIMS data, and it's available on our website. From February 1st, 2018 to May 31st, 2019, there were approximately 4,400 events recorded. 54% were near misses and 85% resulted in no harm. One of the contributing factors we were seeing was environmental, staffing, and workflow, which contributed to 23.6% of incidents. The college has recently established a practice environment initiative along with partners and stakeholders to better understand what some of these practice challenges are. This type of analysis uses a systems lens. The healthcare system has multiple components and we need to see them as working together. AIMS is about looking at the holistic picture, pharmacy and beyond. What are some ways to achieve this? It's recognizing that many processes are linked, including in different locations. All the system working towards a same goal. Measuring is also important to understand the impact we have, but what matters most to our patients and to providers? Oftentimes, this can be answered by asking them. And the college is also working on how to measure provider and patient experience. Learning together across teams and within teams is also of utmost importance. Since implementation in 2018, we are seeing a commitment from registrants, from pharmacy professionals. We are seeing the benefits of having data to inform decision making. We are seeing the fruits of shared learning, and we are continuously looking at how we can improve and continuously looking to collect feedback to strengthen the program. And ultimately, we've learned throughout this experience and others the importance of patient engagement and have included patients on our task forces and advisory groups such that we can hear directly from them. With that, thank you.
Thank you. Thanks so much for that, Anastasia, for your insightful contribution and for sharing the success and learnings of the AIMS programme. I think this programme is a fantastic yardstick for regulators to benchmark themselves against globally. So I'd like to now pass you on to my esteemed colleague and friend, Dan Burns, who is the Pharmacy Director with Pharmapod. He graduated as a pharmacist from the Royal College of Surgeons in Ireland in 2006. He spent the first part of his career as a pharmacist with Walgreens Boots Alliance, WBA, and then as WBA Pharmacy Operations Manager for Ireland. Before joining Pharmapod, he was Superintendent Pharmacist for the All Care Pharmacy Group, Ireland's largest Irish-owned pharmacy group. Dan has a keen interest in the role of technology as an enabler for better, safer care. He graduated with a Master's in Health Informatics from Trinity College in 2016 and is a member of eHealth Ireland's Council of Clinical Information Officers. He has also sat on a number of Irish Pharmacy Union committees and on the Pharmaceutical Society of Ireland's Standards Advisory Group. Over to you, Dan.
Thank you, everybody. Thank you, Catherine and Anastasia, for your presentations, and hello to everybody who's listening today. So just before we start, a little question for everybody to think about in line with the theme of today's webinar. So just a quick poll, is it a requirement in your country for pharmacists to record medication errors?
We have just launched the poll, Dan, and we're getting in some answers live, so we'll just wait a few seconds. It's looking a little bit like a 50-50, but with a majority yes. So far it's 57% yes, but it looks like it's a yes or no. So a huge variation across the world.
Great, thank you, Lena. That's really interesting to see.
Thank you, Dan. Back over to you.
Great, thank you, Lena. So just to give an overview of what I'm going to be covering today, first I'm going to just give an overview of Pharmapod and who we are. Second, I'll touch on the drivers for change in relation to medication safety and the building blocks that are needed. And finally, I'll move on to responding to the WHO Patient Safety Challenge that has already been discussed on the webinar today, and describe a framework for medication safety programs on a national or on a large scale. So at Pharmapod, while we provide a variety of solutions for quality management in healthcare and pharmacy, today I'm just going to highlight the medication management aspects of the platform. So within those that area of the platform and the solution, we provide the facility to capture medication incidents and near misses. That's within a shared, secure online platform that's accessed through any web browser. And within the tools, we have embedded continuous quality improvement tools throughout to help encourage reflection and learning in real time by people who are recording through the platform. Data that is recorded is then aggregated into dashboards and reports for real-time analysis. Throughout the platform, we provide a very big focus on having an intuitive interface and being user-friendly. And it's very important to us also that because we are a professionally led organization, that our system is built on a culture of learning. The system is highly customizable and can be adapted for organizations or for different countries that we operate in. And it's also available in multiple languages and can be accessed across multiple platforms, including tablet and mobile device. And because it's a cloud-based infrastructure, it's highly scalable, and we currently have over 12,000 users internationally on the system. In the interest of time, I'm just going to show you a small number of screenshots of what the system for medication management and analysis looks like. That will hopefully bring it to life. Of course, if anybody would like to see the system in more detail, we'd be happy to arrange this after the webinar. So this first screenshot shows an example of an incident form, and you'll see those continuous quality improvement tools that I mentioned along the right-hand side of the screen. And these are designed to encourage reflection and learning by users as they record incidents and near misses. These include, for example, completion of root cause analysis and the creation of corrective and preventative actions. All users, whether they are providing care at pharmacy level or overseeing a program at regulator level, can be provided with a dashboard that summarizes key data. And importantly, this is customized so that it is showing them the data relevant to their role and setting. And then sitting behind these dashboards are an extensive suite of reports, again, customized and relevant by role, that allow powerful analysis of data to be completed to help generate shared learning and improvements. As I mentioned, Pharmapod is an organization who are professionally led, and advancing patient safety is at the core of what we do. And we have been a trusted partner with a variety of stakeholders nationally and internationally. And we are extremely proud to have signed the partnership agreement that Catherine mentioned in her presentation just a year ago now at the regional conference in Amman. A key aspect of that partnership agreement is addressing the WHO Patient Safety Challenge by providing an infrastructure to member organizations through our incident management solution. Anastasia also mentioned that the solution selected for the AIMS program in Ontario is Pharmapod, and all 4,500 pharmacies in Ontario submit their incidents and carry out learning through the AIMS Pharmapod platform. So when we think about how we can improve medication safety, there are a number of barriers that we need to address that we know can prevent progress. These can start with underreporting. So if we don't have the data, we can't learn from it. If the data isn't usable or it's not shared because maybe it's locked in paper-based reports, then you're missing opportunities for learning. Having limited or no feedback to those who are reporting means they don't feel the benefit of recording into a system for reporting. And this means that there are missed opportunities for improvements and missed opportunities for tracking those improvements. And this leads to what we're seeing in practice, which is an increasing burden and incidence of medication errors. However, as has been touched on the presentation so far, there are many things happening globally and locally in relation to driving change for improvements in medication safety. And I suppose this has really been driven in large part by the WHO Global Patient Safety Challenge. As has been mentioned, it's theme, the theme is reducing severe harm by 50% from medication incidents over a 5-year period. This has in turn resulted in a wide-ranging and extensive response at a global level to address the problem, and with many countries making medication safety a key policy focus, and others such as in Ontario, where they've gone even further and developed large-scale programs for medication safety. As Anastasia referenced so powerfully, the patient voice is so important as a driver for change also. Patients accept that things can and do go wrong, but they also expect that controls and processes are in place to reduce occurrence of error and prevent reoccurrence. So when we think about the building blocks for addressing the WHO patient safety challenge, there are a number of key things that we believe need to be in place. First of all, the right regulation or legislation needs to exist. This may already exist, and we can see from the poll at the start that it's quite a mixed bag internationally. Maybe existing regulation needs to be amended or clarified, or regulation maybe need to be created. But what is needed is a mandatory requirement for errors and near misses to be recorded, with an emphasis on shared learning and improvement. Taking best practice approach to program design and implementation is key. Learning from others, such as the example in Ontario with the AIMS program, and involving experts, including academics with relevant expertise, pharmacy representative organisations, and so on, is so important. And the third building block is having a scalable technology solution backed with domain expertise. This will allow data to be generated for learning improvements, and a blueprint can be followed for successful implementation that can be adapted by other countries or organisations. Leadership and shared vision, along with a safety culture, are essential components for success. Everyone here, I believe, has a part to play in this. People in leadership positions who are dedicated about making change happen, and also pharmacists working on the front line who have a responsibility to encourage open and a transparent approach to reporting and learning from errors. From our experience, coming to a consensus and taking a national or system-wide approach will deliver adoption and improvements at pace. I've spoken about Pharmapod as a professionally led solution provider. For us, taking a holistic approach to medication safety management is crucial to success. And this involves the following steps. First of all, the recording. As Anastasia mentioned, if you don't have the data, you can't generate the improvements. And analysing that data in real time, identifying trends and identifying risks, to then put plans in place to mitigate those risks and create actions for improvement. And subsequently then to implement controls by sharing learnings, implementing improvements, and strengthening knowledge where it's needed and controls, for example, through training or changes to practice or regulation. And finally, evaluating and reviewing, so assessing the controls or improvements that have been implemented against the live data to see if they are delivering the improvements that were hoped for. Gathering feedback, as Anastasia mentioned, is such an important part in the spirit of continuous quality improvement to try and drive improvements to the programme. And also thinking about opportunities for formal research that may generate learnings on a global level. Anastasia mentioned the response team, and operating in tandem with the programme in Ontario, we strongly believe that we need to have a method to analyse the aggregate data, and that this will be carried out by a team with relevant expertise. This ensures that the appropriate rigour and impartiality is applied to the shared learnings and recommendations for practice improvements that are then shared back to the pharmacy profession. And finally, just thinking about the benefits of taking a systems approach to implementing medication safety programs. From a regulator perspective, it means that there is a consistent approach across a large number of pharmacies or pharmacy professionals, which will help deliver improvements at a systems level. It also helps to demonstrate a commitment to advancing patient safety and to addressing the WHO challenge. It provides visibility of national data and national and international benchmarking. Pharmacy professionals, it means that there are efficiencies through reporting in a consistent and digital format. It means that peer-to-peer shared learning can be encouraged and supported. and a reporting and safety culture is fostered. And ultimately, it helps to reduce risk in practice for pharmacy professionals. And then importantly for patients, it will mean over time a reduced risk and harm, increased trust in the pharmacy profession, improved patient outcomes, and consistent high standard experience of patient service. Thank you everybody for listening today, and please stay safe in these difficult and challenging times.
Thanks so much for that engaging presentation, Dan. And as Dan said, if anyone would like any more information on the Pharmapod platform, please don't hesitate to reach out to either one of us after this webinar. I think we're going to be moving to a panel discussion now. Is that right, Lena?
Yes,
yeah.
Aisling.
So I'd like to introduce, and I'm proud to introduce, our CEO of Pharmapod, who will be joining this panel discussion. Leonora O'Brien is the founder and CEO of Pharmapod. She's over 20 years experience in pharmacy practice, governance, policy development and regulatory affairs at national and international level. She is the former superintendent of Unicare Pharmacy, which is the largest pharmacy group in Ireland, and a consultant to the Pharmaceutical Society of Ireland, the pharmacy regulator in Ireland. Named as top digital health influencer in Ireland in 2013, among other awards, Leonora is the strategic compass of Pharmapod, and it's great to have her here on our panel this afternoon.
Thank you, everyone.
Welcome, Leonora. Aisling, we're having lots and lots of questions coming in, and I'm just filtering through them. But I would like to maybe ask a question myself before we do that, and a question to Leonora. Thank you for joining us, Leonora. I just wanted, and hopefully that's what everybody else would like to hear, your reflections as well, after having listened into our panelists, your reflections on patient safety, especially during the times we're facing now. It would be great to hear from you.
Thank you, Lena, and thank you for the invitation today, and for FIP for facilitating such great webinars on a weekly basis now, to bring together the pharmacy community across the world. So I believe the WHO ambition to reduce medication errors by 50% over the next 5 years seems to be a very lofty ambition. However, we have the skill as pharmacists, we have the will, and we just need a scalable infrastructure to share the learnings and to capture the learnings across the profession internationally. So both at a national level and then on an international level. So I think the building blocks, once you have those foundations, you can really achieve a huge amount and drive that significant improvement internationally. As we've seen by working very closely alongside the OCP, it is easy. There's a standardized way, there's merit in standardizing a program. So if everyone across a particular country is using the same data field, then it makes the analysis a lot easier. And then from country to country, you can account for local legislative differences and nuances, so that's important as well. But all the data can be mapped back to one source of truth, and it may be in the future just possible for key stakeholder internationally, such as FIP, to have that dashboard. I really believe, as pharmacists are the medication safety experts, the medication experts within that healthcare team, that it's incumbent upon us as professionals to lead and take a leading role in the reduction of patient harm relating to medicines, in line with the WHO Patient Safety Challenge. So delighted that so many collaborators are coming together internationally, and technology really does help to facilitate that.
Thank you for that, Leonora, and thank you for that powerful statement and a reminder of our role as pharmacists in our commitment to upholding patient safety. After all, I do have a question/comment, and I think that might be for Dan, from Heather. Heather says, huge challenge for me as a regulator is finding a way to very quickly and efficiently document near misses. I have them understanding the need for reporting actual incidents, but how can Pharmapod help with making reporting of near misses less onerous so that it will actually happen?
Thanks, Lena, and thanks, Heather. This is something that absolutely is a consistent challenge, and it's both, I suppose, a technology aspect of this, but also a behavioural aspect, trying to help pharmacy teams understand the importance of recording near misses. So from a technology perspective, what we try to do is to make it as simple and quick as possible. In busy pharmacy environments, it's all about trying to streamline workflows and incorporate reporting and recording into the existing workflow as smoothly as possible. So, for example, in practical terms, what that means for us is that when we capture details of near misses, it's a significantly shorter process and a shorter form than an incident that has actually reached the patient. But there's a really important educational piece then about why near misses are so important to record, and to Anastasia's point, the types and instances where near misses are important to record, so that we get those shared learnings from what could have become an incident that reached a patient or that led to patient harm. So I think there's two aspects: making it as quick and easy as possible, and also supporting the understanding through training and culture within the pharmacy teams about the importance of recording.
Thank you for that, Dan. I do have a question here for Anastasia, and apologies, I can't tell who it's from. The question is, what are the lessons you learned at the college to respond to safety issues in a proportionate way whilst still ensuring practice is safe?
I think that's a great question, and we continue to learn what that balance is, and looking at the data, trying to determine how to look at it, and how to respond appropriately in a way that perhaps takes into consideration things that are more of risk. So we certainly are taking a multi-pronged approach in terms of trying to address what it is that we're hearing, and continue to evolve as we learn how to optimize the use of the data and how to best share that back to the profession, and learn about best practices that are even happening. We've learned of some pockets of innovation in different pharmacies, and how can we help to ensure that that is shared throughout. So it is really a work in progress, and we're constantly evolving and learning as the program matures.
Thank you for that, Anastasia. And I think we all can agree that we're all learning with the program, and we look forward to further results and outcomes and evaluation results from that as well. We're all going to learn from that. I have a question, and that's a comment for Anastasia, but also a question for Catherine, really. And Melissa from Canada says, thank you, Anastasia, for highlighting Andrew's story in the development of AIMS. How can FIP use the pillars of the AIMS program to spread the uptake of safety culture across the globe? Big question. Catherine?
Well, I think today's the starting point for that in a very serious way. I think there's a lot of good practice here that we can learn from and build on. And I think what would be really good then is to share what those pillars have in common with others, and maybe for FIP to pull this together as a set of case studies or examples of excellence, because what we know from hearing from Anastasia today is the Ontario College of Pharmacists has really demonstrated excellent ways of ensuring safety. Many of those principles should underpin how others set about developing their systems of safety and their regulatory frameworks as well. So I think I'm listening today, and I'm thinking there's a lot of case studies and examples we can pull together that bring some of our publications to life in the next iteration. Perhaps some toolkits would be useful for colleagues.
Thank you, Catherine. I have a number of questions that perhaps are all related to the same issue, which is the additional difficulties facing countries that don't have regulations in place. And I have a question from Satish here, and I think that may be something a few of you can touch on, but how can we encourage pharmacists to report incidents and near misses when there is no regulatory requirement? And I think that's the real challenge. Maybe Dan, I'll call upon you to give us your reflections on that.
Thanks, Lena. I suppose from my perspective, again, it's really down to culture and I suppose professional accountability. And I suppose if there's a kind of a rising groundswell internationally that reporting and learning from incidents is the right thing to do, then that will encourage a greater adoption in the absence of mandatory reporting. But I think having that accountability at a professional level is really key. Again, then making sure that there is benefit seen to reporting. So if somebody reports onto a piece of paper or reports into a portal that they never get any feedback from, then they're going to see limited benefit to them of reporting. Whereas if they're getting regular shared learnings and outputs back, either directly through the system or through more formal bulletins or reports, then they're more likely to engage with reporting on an ongoing basis. And I think the other thing that's really key is having a whole team approach, so that it isn't just left to one person in a pharmacy to be the person who reports. If there's a really open culture of reporting, then it should be across the pharmacy team, that people are actively reporting and reflecting on what has gone wrong and how you can prevent that happening again.
That's really helpful. Thank you, Dan. I do have a question, and perhaps maybe I'll ask both Leonora and Anastasia to touch upon it. It does affect, well, we can look at it from different angles. Basically, the question is from Zilzaga. Sorry, I can't see where you're from. Please, everyone, if you're sending in questions, do let us know which country you're from. That's really, really great. Zilzaga is asking, what would be the strongest influence or indicator for, or success factor really, for initiating patient safety programs more nationwide, especially when we're facing fragmented pharmaceutical regulatory systems, poor leadership, high rate of irrational use of medicines, etc. So again, more of the same in terms of how can we overcome these issues and implement more successfully and on a national level patient safety programs. Maybe from Pharmapod's point of view, Leonora, what would be your answer to that?
Thank you for the question. It's a great one, Zilzaga. I would have said, to be honest, you've answered your question. Leadership is so critical, and culture, because to have the right culture in place where it's not a punitive culture, it's critical, because people need to have a safe, psychologically safe environment before they are open to sharing the mistakes or errors that they have been involved in. So in the absence of effective leadership in a particular country, for example, if that was the case, or if it was felt it was the case, then each pharmacist managing their particular practice can take it upon themselves to be that leader and to help to train their teams in leadership as well, to put in systems themselves to record, review and analyze incidents, and then their team will start to learn from those incidents. They will see the value. Just try and highlight their great work as ambassadors and as peers, because peer learning and it's such a powerful thing. So people need ambassadors to inspire them and to aspire towards, because there is that adage, if you can't see it, you can't be it. So really highlighting the good work that people are doing. And there's brilliant work being done in every single country in this. Sometimes it unfortunately is just in a silo if the regulations aren't underpinning it on a national level. But certainly if we keep highlighting the good work that's been done locally, then the snowball effect will happen. And then, you know, it can be certainly rolled out. But leadership, as we've seen through COVID-19, leadership is critical to underpin the behaviours across particular countries.
Thank you for that, Leonora. Anastasia, wondering if there are any learnings from the program at OCP with regards to nationwide implementation, or any reflections from that. And we had Zilzaga responding, saying she's from Mongolia. Welcome, Zilzaga. Thanks for joining. Anastasia?
Yeah, thank you for that question. And thanks, Leonora, for your comments. And just to echo that sentiment, that I do believe that it is a matter of even starting small within your team, removing that stigma of making a mistake or being involved in an incident, to really then be able to transcend and start talking about how to learn from that. Even before there was a mandatory program in Ontario, there was incident recording that was happening. And so it can still happen, and perhaps that's the grassroots of moving towards a mandatory program. And then in addition, there could be perhaps that the fact that learnings don't have boundaries, how to create a global community of learning from different analysis and insights that are happening, recognizing there might be different contexts and different factors in different countries and areas, but there still could be some learnings that could be applied.
Thank you very much for that, Anastasia. I think I have one more question coming in for Dan, and then perhaps one general question for everyone, and then maybe we'll close. Question for Dan from Satish from Trinidad and Tobago. Thanks again, Satish. And Dan, he says you have been brilliant alongside the ladies. Do you think a pharmacy bulletin newsletter can assist in the absence of regulation to report in a national website initiative?
Thanks, Satish, for your question and for your feedback. So I think, yeah, what shared learning in whatever format is valuable, and there's different ways that can be achieved. And I think any initiative needs to have probably a multi-pronged approach, because people absorb information in different ways. So absolutely, in the absence of a structured program, having feedback on medication safety incidents and learnings can be shared through things like websites or online bulletins, or even, you know, today is a shared learning opportunity. So webinars or podcasts, and you know, there's lots of different formats and ways to consume this type of material in a way that works best for people, and when people are you know, busy in their pharmacies, having different ways of communicating that information is very important.
If I can just jump in there to add, it's Leonora here, to add to that as well, following on from what Dan said. And the bulletins and newsletters are great, and it all depends on your audience and how they like to absorb the information coming in, or what infrastructure they have. But certainly the more measurable you can make your content, the better. So we are now starting to send notifications and alert through the platform at Pharmapod, because and there's short sound bites of information, because then you can track and measure the impact of your communication, which is really important. In the same way as you need to be able to measure the incidents that are occurring in order to be able to improve it, it's the same with your communication. So we need to approach communication strategy with that mindset. We need to be able to track and measure everything we do. No point pushing out a load of communication to the pharmacies if we can't measure that it's the right forum to send that communication, or it's accessible because of infrastructure, or they haven't read it, or they haven't read and understood it, or closing the loop. We need to make sure that it's actually caused the change that we wish to see. So if it was intended to reduce a particular issue around a certain drug, well, then we need to keep tracking the issues with that drug to make sure that our communication has had the intended impact.
Thank you for that really valuable addition, Leonora. I think we're coming up to our last question, Ashleen. So if it's okay with you, can we ask the same question to everybody and just hear from everyone before we wrap up?
Yeah, of course. Yeah, go ahead, Lena.
Thank you. The question is from Calvin from the Philippines, and we're circling back to regulators really. How can regulators be more adaptive to international policies if there is no initiative or interest from the regulators themselves? Perhaps I'll ask Anastasia first, and then we'll go around the table.
Thanks for that question, Calvin. I think it is really one important element is just about creating that coalition of partners and stakeholders with shared learning, or with shared interests, such that you're really creating a common goal for everyone. So just finding that common thread or the common link to really highlight how such a program or how taking these steps will actually result in something fruitful. So partnerships and collaborations have been important for rolling out the program, and if that be with the different areas of government, or if that's with different organizations with shared interests, it is just, I think, about finding that common goal and coming together to determine what is needed to achieve that.
Thank you, Anastasia. Maybe we'll hear from Pharmapod, Leonora and Dan. Leonora, what are your thoughts on this?
I think if there was one thought to highlight on that, if you're a regulator in a particular country, it does seem, given how busy, especially with COVID, that you are supporting the pharmacies and making sure that the pharmacies are regulated effectively. But this is easy and doable. And now we have a template for being able to roll out these national programs, and we have organisations such as the OCP that have managed to do that, which is great, because now we can share those learnings, and the OCP can share those learnings with peer-to-peer regulators. So we don't have to invent the wheel anymore, which is fantastic. So although it does seem daunting rolling out a national programme, it can be very much planned out into milestones. And then I do agree with Anastasia, absolutely getting your stakeholders on board is really important in your particular country, but certainly rolling out an infrastructure and a training programme for the pharmacies, it has been done before now, and it is very feasible to do.
Thanks, Leonora. Dan.
Yeah, I suppose echoing absolutely everything that's been said it's all really valid and important stuff. And I suppose, not to steal Catherine's thunder, but using the FIP regulator forum as a place where these learnings can be shared and using the tools available already, so that to Leonora's point, it doesn't seem like an overly daunting task. It's following a blueprint or a plan that's already been successfully implemented. Albeit that there'll be some adaptation needed for different countries or organisations.
Thank you, Dan. Catherine, what are your thoughts on this?
So thank you, Lena. That's thanks, Calvin. Really good question. I think the thing to note that FIP can do is to provide a space for discussion. So sometimes this can be a round table, or it can be like we have today, where we can share experiences, or we could host a particular summit on a particular event where regulators or countries can hear examples from other countries. And there's nothing like putting the patient at the centre to ensure that this gets the right bandwidth in terms of health policy or regulatory policy in different countries. Then following that, we can support member organisations in different countries to lobby effectively for appropriate regulations, or even support the setup and development. And Dan's quite right to mention the Regulators Forum. There can be some advice on how it has been done in other countries. Finally, I would say there's something very practical that we learned from our vaccination reports and with our report on safety and NCDs last year. We need to move from report and policy into support and implementation. And there's something about us creating an advocacy toolkit or some such supportive document that different countries can pick different chapters and use them for their needs. And they would be useful in terms of having conversations with health ministers, or even getting colleagues from different countries to come in and help and assist and lobby. And that's really what I meant right at the very start of the conversation about we can support and enable good regulation in different countries. We can bring people together so that good regulation can be shared, and we can highlight examples of excellence. So again, people can learn from that, and we can support our member organisations to lobby for this. I think there's never been a time where nimble and appropriate regulation to ensure safety is needed, but also supportive regulation whereby individuals can practice at the top of their licence and really deliver in a flexible way for patients and the public that we serve. And you can see that with the fact that our community pharmacies no matter what country you're working in, are regarded as key workers, and look at the work that the colleagues in hospital or in clinical biology or in emergency situations are also providing as well. It's very humbling. So we're here, and I think there's some very practical and supportive next steps, as well as some very big advocacy roles that we can provide for colleagues who need good and adaptable regulation. And the final point is, you've got some colleagues here in Pharmapod you can call upon with examples of safe systems, and you've got some colleagues here who can advise on policy from the actual experience end of it. And that's, I think, my reflections really. Thank you very much, Lena. Thank you, Calvin.
Thank you so much, Catherine, for that. And thanks to all our panelists and speakers for their insights, contributions. And on behalf of Pharmapod, I'd just like to thank Lena and Adlan and the rest of the FIP team for their work on preparing this webinar and for their valued partnership and leadership at this time. And thanks to all of the participants today for your engagement and interest in this webinar series. I'll just pass back to you, Lena.
Thank you very much, Ashleen, and it was a pleasure co-moderating with you. Thanks to all of our panelists and to Adlan, who's helping us behind the scenes as well. I just wanted to, before we wrap up, and just after thanking everyone, tell you about our upcoming events. You will, all participants on this webinar will receive an email with registration details, but we have two exciting events coming up next week. One on Wednesday, and this will be our first Hearing from Our Heroes webcast, where we partnered with a Polish pharmaceutical group and particularly their Pharmacy Heroes campaign, and we'll be hearing from pharmacists on the front line in the Philippines, Lebanon, Spain, Pakistan, and Poland about their experiences. And we'll be conducting lots of these webcasts. So if you are on the front line and would like to share your story, please do email me at lena@fip.org. Also next week on Thursday, we will have a really nice conversation, hopefully, with the American Society of Health System Pharmacists. And in this webcast, we'll really try and find out more about what's happening at the USA in the front line from pharmacy's point of view, and how the society is supporting the profession and what tools and resources it's offering to everyone around the world, not just to the US. So we thank you in advance for considering to attend these. We look forward to having you at our upcoming webinar, and thank you once more for participating today. Together we can hopefully help stop this pandemic as soon as possible. Thank you from everyone from FIP and all around the world. Thank you so much.